All right, we'll go ahead and get started. So this is actually the last presentation of the semester here. And what we're going to do is just go over what I would have assigned for the exam for this semester, which actually, because of the length of time towards the end of the semester and everybody's already checking out, is actually a pretty easy exam. It doesn't take a lot of time. So basically in this one, I was just going to give you the opportunity to pick a disorder and just describe it, answering these questions, basically. So the instructions were Google a psychological disorder that interests you and answer the following questions regarding it on a separate typed page. And so I was, do a little research, find a disorder. What I'm going to do, just, as an example here, is I'm just going to open up the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, to one, and I just randomly opened it to dissociative disorders. So let's find a specific dissociative disorder, and I get to a dissociative identity disorder. And the first question was, does the order affect perception or learning or both? And if I look at the diagnostic criteria, I see disruption of identity characterized by two or more distinct personality states, which may be described in some cultures as an experience of possession. The disruption in identity involves marked discontinuity in sense of self and sense of agency. So there's perception, accompanied by related alterations in affect, behavior, consciousness, memory. There's perception, cognition, and or sensory motor function. And these signs and symptoms may be observed by others or reported by the individual. And so in this case, does the disorder affect perception or learning? I think we'd be safe to say perception, explain. Well, I would just explain what I had put, what they had stated in the diagnostic criteria there. The good news about this is if you wanted to do one of these on your own for extra credit, is that you don't need the DSM-5. I'm only doing that so I don't have to keep flipping screens. A lot of the stuff from the DSM-5 is already on Google, and you can just look it up yourself. So number two, what are research psychologists doing in regards to your chosen disorder? That would be something that would be kind of hard to find, I think, in the DSM-5, but we could look it up online. And so I'm probably just going to skip that one, but we certainly could Google something along the lines of research into dissociative identity disorder and find what's going on there. How are clinical psychologists and psychiatrists approaching your chosen disorder? Well, in the DSM-5, we can look up here the differential diagnosis, and some of the diagnostic features. So for example, functional consequences, differential diagnosis. So let's look at major depressive disorder, which is a differential diagnosis here. Individuals with dissociative identity disorder are often depressed. Symptoms may appear to meet the criteria for a major depressive episode. Rigorous assessment indicates that depression in some cases does not meet full criteria for major depressive disorder. Other specified depressive disorder in individuals with dissociative identity disorder often has an important feature, and that doesn't really help us very much. But we know, that the defining features of dissociative identity disorder is the presence of two or more distinct personality states. And we also know from what we learned in class that this type of dissociative identity disorder is probably best treated with psychotherapy and sometimes medication. And I'm looking for the specific words in here, and in the interest of time, I'm not really seeing it, but to Google it would be a lot easier maybe than just looking through this to find that. A lot of this stuff in the DSM-5 specifically is just diagnostic. How do I diagnose it? Not necessarily treatment. And so I might have a hard time actually finding the exact words in here for the treatment itself. So we'll move on to number 4 here. Describe what has gone wrong in the brain in this disorder. It varies as a function of psychological motivation, stress, culture, internal conflicts and dynamics, and emotional resilience. Sustained periods of identity disruption may occur when psychosocial pressures are severe and or prolonged. In many possession form cases of dissociative identity disorder, and in small proportion of non-possession form cases, manifestations of alternative identities are highly overt. Most individuals with non-possession form dissociative identity disorder do not overtly display their discontinuity of identity for long periods of time. Let's see. Strong emotions, alterations in sense of self, and loss of personal agency may be accompanied by a feeling that these attitudes, emotions, and behaviors in one's body are not mine and or not under my control. So what we could say is happening in the mind here: lapses in dependable memory, dissociative fugues. They may report they have suddenly found themselves at the beach, at work, in a nightclub, or somewhere at home with no memory of how they came to be there. Amnesia. So basically, something in the brain is not communicating with something else, that it has separated from, hence the dissociative part of it. So we can say what has gone wrong in the brain in your disorder, and we can talk about disassociation here. Describe how your order is diagnosed, and this is really where the DSM-5 comes in handy. All those diagnostic features I've already been telling you about certainly would tell you, okay, here's how you diagnose it. Even some associated features supporting diagnosis. For example, individuals with this identity disorder typically present with comorbid depression, anxiety, substance abuse, self-injury, non-epileptic seizures, or another common symptom. They often conceal or are not fully aware of disruptions in consciousness, amnesia, or other dissociative symptoms. And many individuals with dissociative identity disorder report dissociative flashbacks during which they undergo a sensory reliving of a previous event as though it were occurring in the present, often with a change of identity. Partial or a complete loss of contact with or disorientation to current reality during the flashback, and a subsequent amnesia for the content of the flashback. So things like that certainly would be in this book. What problems in diagnosis exist for your disorder? And that's where we kind of get into the differential diagnosis, because it could be several other things that are related to this, such as comorbidity. Many individuals with dissociative identity disorder present with a comorbid disorder, and it might just be a comorbid disorder instead of this. Personality disorder, seizure disorder, factitious disorder and malingering, substance abuse, post-traumatic stress. So there's major depressive disorder, bipolar disorder. So there is some things in here that would suggest that there might be some other disorders that are very similar to this that would make diagnosis a little bit hard. What is the DSM-5 definition of your disorder? And I read that at the beginning, the diagnostic criteria here of dissociative identity disorder. What classification is your disorder under the DSM-5? And the classification here is dissociative disorders, characterized by disruption of and or discontinuity in the normal integration of consciousness, memory, identity, emotion, perception, body representation, motor control, and behavior. So that's the category that it's in. What are the characteristic traits of your chosen disorder? And that's what I just read to you. What are the common treatment plans for your chosen disorder? And again, that's where we would get, and I would maybe go into a little bit more detail about psychotherapeutic or the medicinal treatments for this disorder, which are going to be hard to find again in the DSM-5, but can easily be Googled. What perspectives are utilized in treating your chosen disorder? Well, it is psychotherapeutic, so certainly we're going to use a psychoanalysis, medicinals, biological. So there's two approaches that we certainly would use in combination to treat this. What are the steps in progression? That's again, details that you could find by Googling. What influences the success or failure of the most common therapeutic approaches in your chosen disorder? Again, that's something the DSM-5 is really diagnostic manual and helping you find, do they actually have this, more so than the treatment of it. However, there is a section about functional consequences. So functional consequences of dissociative identity disorder. Impairment varies widely from apparently minimal, for example, in high functioning professionals, to profound. Regardless of the level of disability, individuals with dissociative identity disorder commonly minimize the impact of their dissociative and post-traumatic symptoms. The symptoms of higher functioning individuals may impair their relational, marital, family, and parenting functions more than their occupational and professional life. And with appropriate treatment, many impaired individuals show marked improvement in occupational and personal functioning. However, some remain highly impaired in most activities of living. These individuals may only respond to treatment very slowly, with gradual reduction in or improve tolerance of their dissociative and post-traumatic symptoms. Long-term supportive treatment may slowly increase these individuals' ability to manage their symptoms and decrease use of more restrictive levels of care. So that's all those, but then that went a lot quicker than I was afraid it would. So let's look up some of the questions that we actually did skip online here, and we'll start with the research psychologists are doing in regards to this chosen disorder. So let me bring up Google. Bear with me for a second. So we got recent research on multiple personality disorders, neuroimaging techniques, which would get into the biology of it, short medical and international study that followed 280 patients with dissociative identity disorder or a variant of it, and 292 therapists over time found the approach was associated with improvements across a number of psychological and social functioning areas. So there's lots of things out here that would help us as to what is the current research regarding dissociative identity disorder. Matter of fact, this Inquiries Journal one right here looks pretty good just based on the title, Dissociative Identity Disorder Overview and Current Research. So if we go on that, there's an abstract there. It's a fascinating disorder, apparently, that probably the least extensively studied and most debated psychiatric disorder in the history of diagnostic classification. Maybe we didn't pick a very easy one then, but you certainly can pick an easier one than this. It requires the presence of at least two personalities, with a personality being identified as an entity having a unique pattern of perception. The prevalence and continuity, client characteristics, courses and prognosis. Course and prognosis is uncertain. Other individuals with comorbid disorders, it's less favorable. Other factors, including a poor prognosis, again, gets into a couple of other questions, include remaining in abusive situations, involvement with criminal activity, substance abuse, eating disorders, or antisocial personality features. Some of the research here, the risk of developing a dissociative disorder increased 7 times with a child's exposure to trauma. A later diagnosis is twice as likely when the child's mother had experienced trauma within 2 years of the child's birth. Studies on genetic factors present mixed findings. However, one study involving dizygotic and monozygotic twins found that considerable variance in experiences of pathological dissociation could be attributed to both shared and non-shared environmental experiences, but hereditability appeared to have no effect. So, these are some things, some treatments, again, psychotherapy, medication are going to be the two main ones for a disorder like this. Some integrative treatment plans. So this looks like a pretty good article, even though it's just an abstract for us to answer those questions. So let's look at the next question. Besides the research, how are clinical psychologists and psychiatrists? We've already got that. What are the common treatment plans for your chosen disorder? And again, we can go back and look here in the abstract down where they talk about it. So we know it's psychotherapeutic. The ultimate goal of treatment is integrated functioning of the alter personality. So this is how it would go. Treatment most commonly follows a framework of, and this actually answers another question on there, the steps. Safety, stabilization, and symptom reduction, working directly and in depth with traumatic memories, and then identity, integration, and rehabilitation would kind of be the steps there. And while each element of the elements of each phrase occur through treatment, these phases describe the dominant concerns of therapy during the stages of treatment. So that kind of answers that question there. What perspectives are utilized? I think we discussed that. Freud's psychotherapeutic approach. What are the steps in progression? That's the question we just answered. And what influences the success or failure of this? I think we can get into, in this case, the goal of treatment would involve working towards a cooperative functioning of alters, and working with alters. Therapists should view alters not as problems to be removed, but as the client's creative response to trauma. And so them not being able to recognize the trauma, or for them to get in touch with their emotions or memories regarding the trauma, might be problems. It is complex. The lack of conclusive research might, hinder you in the treatment. They might not have a good social support system in the last paragraph here, because research supports the importance of social support as a preventative factor. All efforts should be made to discover sources of support for the client once stability is achieved. Group psychotherapy, group therapy. So you can get kind of what the problems would be from there in regards to this disorder. So this is what I had over here. Actually is a nice little thing where you can click and get most of those answers there. That's why I said Google's much better than the DSM-5 in this regard. But that is basically how you would do that test. And like I said, it was intended to be short and easy, just an easy test score to boost your grade at the end, when everybody's already at this time normally thinking about prom and graduation and just the end of the year type stuff. I don't like to load a lot on you. So this would have been a very easy test. If you still want to complete it for extra credit and get a 100% test score added to some previous test score, I'm all for that. Like I said, there's no reason anybody shouldn't have an A or a B on this. So do you have any questions regarding this? Okay, short and sweet. That was the last presentation of the semester. So Jillian, particularly, it was a pleasure having you as a student these past 2 years, and hopefully you'll friend request me on Facebook so we can stay in touch. I'd like to continue to follow you.
Okay.
I walked by a house yesterday and they had a graduation sign out there for Carthage College. Do you know who that would be? Lives right next to Cami Titus, or at least a couple doors down.
Cami Titus?
A couple doors down from her, there was someone in their yard. They had Carthage College Class of 2020 sign in their yard. And I automatically thought of you because I knew that's where you were going to go. So right next to where Cade Warner lives right now.
Do you think it might have been Cassie Sanders? Didn't she go there?
Oh, you're absolutely right. That is the Sanders house. I'm used to seeing the back side of it, so the front side, it didn't connect with me, but you're absolutely right. That is who that is.
Dang, go me. I'm a good guesser.
So if you don't have any questions, then man, well, I wish it hadn't ended like this. I wish we were in person.
Yeah.
At the end of every semester of psychology, I have gotten a group picture of me and my psychology students to put on my website, and I can't do that this year. So
I'm sorry.
All right. Well, if you don't have any questions, then that's where I'll end it. And like I said, stay in touch. It was a pleasure having you as a student.
You really are a good teacher, and
No, thank you.
I think you have definitely bettered me for college. So
well, good. That's one of my goals, so I hope so.
Yes, you're one of my favorites.
Well, thank you. Thank you.
Yep. Bye, Mr. Klein.
See you later.